Hello to everybody. It's nice to see you. I am subbing in today. Many of you who've been on these calls for a while remember me from the early days, and then Patty Webster has taken over. But for those who don't know, Patty and her husband just moved to Abu Dhabi. Her husband's in the State Department, and they are headed there. She'll still be working with us, but the time zone change was a little rough, and they just got there 2 days ago, so I'm taking over for the day. But it is wonderful to see so many of you on the line, and many thanks to Erik and Chrissy for joining us. Let me make sure I can, I'm going backwards and forwards. Just wanted to give you guys a quick update of what we're planning on doing today, giving you a couple of updates from the Conversation Project team, introducing, soft launching our new patient guide for serious illness conversations that we did with Ariadne Labs, and then really having some time for Q&A. If there is anything else that you'd like to be sure that we cover, please put it in the chat, because we've got a nice kind of intimate group here, and we'd be happy to add that to the list. So a couple of things to keep in mind as updates from the TCP team. If you've been to our website in the last few weeks, you've likely noticed a new look on our website and social media accounts. It's a little more blue and a little less orange. While much about our vision and mission and core message remains the same, you'll see some new fonts and colors that really bring us a little bit more closely tied to our parent organization, the Institute for Healthcare Improvement. We were founded in about 2012, and the Conversation Project has actually always been an initiative of IHI's, and we just wanted to highlight that connection more. We will remain focused on serving you in the same ways we always have, the website staying there. It's just that a few different colors on the page, and we're really focused on helping individuals have these important conversations about what matters most to them through the ends of their lives. So if you have any questions or would want to know more about IHI, you can let us know. I have been at IHI now this summer for 13 years, so 7 of those have been spent on the Conversation Project, but would be happy to answer additional questions for you. Additionally, in the last few weeks, we've made some minor edits to our materials, so I just want to give you a couple of content updates. Some of them are focused on kind of removing unnecessary gendered language, so referencing parents instead of mom or dad, child instead of son or daughter, for example, clarifying a few areas. There was one typo that we had in the proxy guide. So we've made a couple of little tweaks there. And we've mentioned this before, but I just want to make sure that you're aware of that we also updated our licensing agreement on our starter kits. So we now have a Creative Commons license, which means you can add your own questions to the kit. You could adapt it for state-specific language. So if your state says durable power of attorney or surrogate instead of proxy, you can make those changes in the document, and you can make tweaks to really tailor the kit to your specific needs. We have additional information on that if it's helpful, but we found that we were getting a lot of individual requests to make small changes, and so we've changed the licensing so that you can do that yourself. And then finally, so those are kind of some of the smaller changes, but some of the bigger updates that we expect to overhaul all versions of our kits by the beginning of the new year. So it is my recommendation that you use up whatever printed copies you have now. It's not that they won't be useful in the future, it's just that they're going to be refreshed, not only with the updated branding. You're going to recognize a lot, and I should mention that we're going to start with the English language versions first, working on different language translations after that. But we're really working to reach broader audiences, simplify the language that we have, streamline the kits. Some of them are going to get shorter. We've heard from you about printing costs and wanting to reduce page length. There's going to be some new images and illustrations in addition to copy changes. We're planning on keeping the existing kits we have, so there will still be an Alzheimer's kit, there will still be a How Do You Talk to Your Doctor kit. I think that it's likely that we're going to break our proxy kit up into 2, for example, so 2 shorter ones, one on how to pick a proxy and one on how to be a proxy, rather than trying to blend both of those into a longer document. So wanted to thank many of you who helped provide feedback on that this summer. If you are interested in helping with translations or have language requests that you want us to prioritize, you can let us know. But we're really excited about that. We hope that some of them might be ready in December. We're waiting to see how everything works with design and layout, but by the beginning of the new year, we should have those new kits. So That's going to be a new look from the TCP team. I'll pause for a moment to see if there's any questions about that and or any kind of general wanting to know stuff, updates about TCP that would be helpful. So I'll wait for a moment to see if anything else comes in the chat. Always come back to it if not. But with that, I want to introduce you to some of our new work with Ariadne Labs and with Dr. Erik Fromme. I'm going to quickly show you a couple of screenshots of our newest resource and then let Dr. Fromme share more about the reasons why it was developed and how it can be used. Oh, I'll pause for a moment. Erik, you're asking, are there themes to the changes that we're making? I would say there's a couple of themes. We were looking at how is the content resonating with people, and then how does the flow and format work for folks. So an example might be our Alzheimer's kit. It went back and forth a little bit in language about whether or not it was for the patient or for a caregiver, and we're choosing the voice and the audience to be a little bit more clear. So that idea of breaking up the proxy kit, there's going to be one thing that's just, I need to choose a proxy. How do I do that? And to have it be a shorter guide, very clear audience. Or I am somebody's proxy. What do I need to know? The Alzheimer's guide, we're going to focus more on a caregiver, patient, family, loved one, somebody who matters most to the patient at the center. So that's one change. Taking out some things that might be euphemisms that are mostly used in the US or that don't work as well for language translations or might be harder for folks with lower literacy levels, and just making sure that the literacy level across all of the kits is a little bit lower. I mentioned some stuff about removing gender binary and just making sure that the materials feel inclusive to anybody who would be picking this kit up. If somebody is a solo ager, not wanting it to feel bad with all of the reference to how you do this with family and loved ones, and realizing that that might not be something that everybody has. So the concept is still the same, but trying to have it be more useful to more people. And again, with the imagery, having there be more racial diversity, age diversity, disability, having people be able to see themselves reflected in the kit. Those are some of our hopes. The concept is still the same. I think one change that you'll see that feels small and yet is a little bit big is, rather than an emphasis only on what do you want your wishes for care to be at the end of life, there's a little bit more of a shift to what are the wishes for care through the end of life. So that at to through, I think, is going to be helpful for getting more folks who might look at the kit originally and say, oh, this is just for end of life, this doesn't apply to me, that's not applicable to me yet. And to have something where more people could pick it up and say, oh, I should think about this. So this does apply to me. This applies to everybody. I should take a look at this as well. So just some slight, we've been working with a lot of messaging researchers on this, of kind of what are some slight word changes that, again, for those of us who've been using it for a while, I don't think you might not notice major changes, and yet the goal is to reach audiences that maybe would not have thought that this applied to them originally, and try to broaden that. Stephanie is saying, this can wait till after, but I just want to know it. These kits encouraged to be added with advanced care directive when sharing with doctors. Do you encourage them to witness, notarize? Once again, have a lot to review with individuals. So the new tools that we're creating are not intended to become legal documents that need to be witnessed or notarized. They are meant to really be about encouraging conversations that might go along with a legal document or a medical document, or how to prepare somebody for conversations that they might have, or how to focus on what matters. And so actually, we'll share with you some of the screenshots of this guide for this workbook, it's really meant for an individual to go through and think through their wishes and then come up with a plan of how might you document that, or who do you need to talk to next, or what would be those future steps that you take. I'll see if there's different questions. Eric, you're saying when you were at OHSU, you bundled the starter kit with the Oregon Advanced Directive with instructions since it was so confusing. Yes, it is confusing. That's one of my hopes, actually, the fact that we changed things to a Creative Commons license. I saw a group, for example, in Vermont, who made a couple of small changes in our starter kit so that it paired even more naturally with whatever other documents they were going to be handing out. And with kind of contact information of who can you follow up with if you want to know more. Here's somebody local who could help answer those questions for you. So that personalized fit, I think, will go well. And, you know, in Maryland, they say agent instead of proxy. So our proxy kit was going to be hard because that just adds a level of confusion for somebody to say, wait, which things do you want me to hand out? These documents have different words in them. You can start to adjust them so they match whatever words that you want. You can imagine, you know, our target really is within the United States, but we also have international users. It gets into like a whole other layer of complexity when you start to add different countries' rules. We had a request to do a British English translation. So even though it's in English, we need a British version of the starter kit because things are a little bit different. So with that, I'd love to share with you a little bit more about this new workbook. And as I mentioned, I'll hand it over to Dr. Fromme, who can share more about why it was developed and how it can be used. But I guess the short answer is that it's really something that many of you asked for. And as we've been doing work, I think, Eric, you'd probably say the same thing. You can share, like, both the Conversation Project and Ariadne Labs in the space. People were asking for something like this that was kind of in between the two of us. And so it was a really wonderful opportunity to work together. And hope that it'll be helpful for you as you work with patients or individuals with serious illness. You'll recognize some open-ended prompts and scale questions, but the emphasis is really less about end-of-life care issues and more about how to articulate what matters most when living with serious illness. So I'm going to share a couple of screenshots. The tool is available on our website now on the starter kit page, so you are welcome to access it and share it. There's one that also has the Creative Commons license if there's changes that you want to make. It's still very early, so while we've gotten feedback on the design of it, one of the things that you guys know is that we love your feedback on how you might use it or how you might change it. But some of the components of this book is this idea of trying to help people be sure they can understand and articulate their understanding of their current health situation, how much they want to be involved with it, and what somebody should know about them. What does a good day look like for you? What do hard days look like for you? What are your goals, especially if your health situation gets worse? So how to get people, giving some examples, some open-ended areas where people can fill in answers. And then you'll be familiar with some of these scale questions that people can fill out. What are your concerns about medical treatment? Is it that I worry I won't get enough care or that I'll get too much care? So some of the questions are similar. And then there are some that are a little bit different that are more unique to serious illness. You know, how much medical treatment are you willing to go through for the possibility of gaining more time? You know, getting people to start to answer a little bit more about that and offering different ends of the spectrum where there's no right or wrong answer, but trying to articulate what it is that people might be thinking in their heads, thinking about what their fears and worries are, the abilities that are important for them, and what those wishes might be as they keep going. Then encouraging people to think about who are the people that might be involved in the care going forward. So who do I want to encourage to be involved with this, to make decisions on my behalf? So trying to get people to think about the idea of designating a proxy or who's important to incorporate, which healthcare team member am I going to talk to about this? We would then encourage, we have a guide for how do you talk to your doctor. So there might be additional steps somebody might need to feel comfortable bringing something up with a doctor or picking their proxy. But this workbook is really intended to help people think through what their wishes are first. And so with that, Erik, I'd love to hand it off to you to share a little bit more about kind of how we got into this and what you think is important for folks to know.
Sure. And thanks, Kate. And I guess I just invite people to put any questions or comments into the chat. Would love to hear your thoughts. And so my name's Erik Fromme. I'm a palliative care physician and have a clinical practice at the Dana-Farber Cancer Institute in Boston. And but also a lot of my work is with the Serious Illness Care Program, which is based in Ariadne Labs, also in Boston. And for those of you who are familiar with the surgeon and writer Atul Gawande, Ariadne is Atul's sort of health system innovation lab. And there's 5 programs within the lab. Ours is serious illness, but there's also programs addressing safe surgery and childbirth and primary care and childbirth. So I'm delighted to get the chance to talk to you about this wonderful new tool, the What Matters to Me workbook. And as Kate alluded to, really what we're doing is we're sort of blending two different approaches to advanced care planning. I'm guessing you're all very familiar with the Conversation Starter Kit. I was too. I in addition to having completed it myself and got my parents to do it twice now, actually, I also made it sort of the centerpiece of advanced care planning at my previous organization as well, because I just thought, wow, this is so much better than a lot of the stuff that's out there. At the Serious Illness Care Program, we have sort of based our work around what we call the Serious Illness Conversation Guide, which is a single-page guide, which you can see here on the right, which is really intended to help health professionals have a better conversation with their seriously ill patients than they are likely to have if they just try to wing it, which is what most of us do. Could you do the next slide, Kate? So, you know, on the one hand, the Conversation Starter Kit is really aimed for any adult who wants to do some advanced care planning. It is to plan for and talk about wishes for care through the end of life. And it's intended to be used, you know, without any expert involvement needed. So you can download it off the internet and use it. You don't need necessarily any health professional input to complete it. On the other side, you know, the Serious Illness Conversation Guide is not intended for anybody. It's really intended for patients and families with dealing with serious illness. The focus is really on discussing values and goals if their health situation were to worsen. So it specifically doesn't use the language of end of life and really focuses on, okay, you've got a serious illness. How do you want to be taken care of? And what role do you want to play in your care? And often the conversation is initiated by a clinician. So a lot of our work at Ariadne is in trying to teach clinicians and health systems how to have more earlier and better serious illness conversations with the goal of trying to ensure that every patient with a serious illness has the opportunity to talk with their important people about what matters to them. So next slide, please. So then the What Matters to Me workbook, it is really intended. So at Ariadne, we put a lot of effort into preparing clinicians and health systems to have these conversations, but it's always been my feeling that, actually we would be maybe even better off investing time in ensuring that patients and families have the opportunity to prepare for such a conversation. And so that's sort of the genesis of the workbook is, hey, can we create something that is patient-facing that they can use to think about these really pretty deep and intense questions before their doctor is asking them in a kind of a rapid-fire conversation that has to fit into an ordinary doctor visit. So because it is preparing them, with the idea that they might then have a conversation that the clinician is also prepared to have, so it follows the structure and questions and order of the Serious Illness Conversation Guide, but really, as you saw, incorporates a lot of the elegant language, structure, and look and feel of the Conversation Starter Kit. Next slide, please. So if you're thinking about, this is my model for trying to understand, kind of the spectrum of advanced care planning activities, with naming a healthcare proxy being sort of at the top in the whitest part of the triangle, because it's something that any person who's 18 or over can do. People who have, a desire, who are adults, can start to do some planning and talking to their families, doing an advanced directive, completing the Conversation Starter Kit, having a conversation with their important people. People who are dealing with a serious illness, which I'll say for the workbook, we're letting people self-identify as being seriously ill. On the health system side, we have a fairly specific definition of serious illness, which I can talk about more if that's helpful. But basically, the What Matters to Me workbook is sort of fitting right in there at the top of talking to a clinician. So for those of you who are familiar with provider orders for life-sustaining treatment, or POLST, in Massachusetts, we call it MOLST. Every state has their own little name for it. Those are really for people who are not just seriously ill, but where you would not be surprised if they were to die in the next year. And people, actually, ideally for people who are looking to set some limits on their treatment. And then the tip of the triangle is actually end-of-life talk. And since you work in this area, you'll be familiar with the phenomenon where anything you try to talk about with clinicians or patients, they sort of assume what you're talking about is end-of-life talk, and they're like, ooh, that's really hard, that's really scary. I don't know if we're ready for that. And so this diagram is intended to let them know that there is a whole host of things that one can do to prepare for that stage where you're having an end-of-life talk that maybe don't make it necessarily less scary, but make you more prepared for it. So I think that's the last. Do I have anything else, Kate, or is that the last one? Oh yeah, okay. So we've got some use cases. This is what we imagine, how we imagine people might use this workbook. I didn't adhere to the new gender nonconformity, but I could imagine a daughter or a son downloading the workbook and completing it with their elderly parent, and then bringing to a doctor's appointment, and maybe using the How to Talk to Your Doctor guide as well to bring it up. We also, in our work with health systems, it's easy to see how, a clinic that has identified a patient as being a good candidate for having a serious illness conversation could give them this workbook to complete, so that the next time they come in, they can talk about it. I'll say, since I'm a palliative care doctor in a cancer center, I've started giving this to some of my patients. And it's extraordinary, actually, what they write in it. I've been giving it to people that I thought would appreciate it, so I haven't given it to like everybody yet, but what was amazing to me is that they pretty much answered all the questions on the Serious Illness Conversation Guide, so I didn't actually have to ask them the questions. We could just focus on their question, and they actually wanted to talk about their prognosis, and so we spent the whole time talking about what they wanted to talk about, because I already had everything that I wanted to know. So it was really kind of a startling experience. So we'd love to hear if you guys have other things that you think it might be useful in. We'd love to hear about it. And then the last slide, Kate. And just to say, so at Ariadne, we're very big on trying to test the things that we're doing to make sure that they work. And we are taking a very, since this was designed for patients and their important people, we're going to do interviews and surveys of patients and their important people. And we're going to ask them to, complete the guide. We're aiming to get as diverse a sample as we can along multiple different dimensions. And the four main things that we're addressing in our questions is this easy to use, easy to understand? Is it safe? Are there any sort of unintended consequences that we should be aware of or that we can preempt? Is it acceptable to people? And do they find it useful? Last slide, or maybe the second to last slide. So I'll just say that we're gearing up to begin a research study of the What Matters to Me workbook. And so we're looking for people who have a serious illness or people who are the friend or family member of someone with a serious illness who they think might like to participate. The study is pretty simple. You complete the workbook, you talk about it with someone, either with your important person or with a health professional, and then you participate in an interview with us by phone or Zoom and complete a questionnaire. And so if you're interested in being a part of the study, and I'll say we're interested in really the patient and caregiver voice here, you can complete the survey at the end of this call or reach out to Kate, and there's her email address, and she'll connect you with us. So I think that is actually my last slide. Now I'll
Great.
Yeah, turn it back
Thank
to
you. I would add here, because we know that so many of you are champions within your community, even if it's not you who thinks you might be able to be part of the study, but there's somebody that's in your community that you feel like could benefit from this, or, I have a friend who's helping care for her father right now, and she got a sneak peek of the guide as it was coming out because it was going to be really timely and useful. At this point, our goal would be, yes, share the tool on its own, hope that it's useful for people. If you think there's somebody who'd be willing to give feedback or talk with us about those parameters that Erik laid out of kind of the usefulness of it or areas for improvement, we would love to be connected to them. So it could be you or somebody you know. I don't know, Chrissy, is it showing that I'm moving the slides? Do you see that I've moved us to the Q&A slide?
Yep, you're on the Q&A.
Okay, great. So just wanted to pause and see what people think. Does this feel like it might be useful personally or professionally? Is this something that you've got thoughts on how you might get the word out, who might be interested? If you have suggestions for us on how to disseminate it, that would be great. I see a note from Patty. Sounds really helpful. I'm going to recommend at least one person for your testing of the new instrument, so that's great. I will include a link to the kit directly in the chat here for those who haven't seen it yet. But we'd just love to kind of have it open to chat. You can also raise your hand. I can't remember, Chrissy, if we can unmute people if they want to talk or if it all has to be done by chat.
Yep, if people want to unmute themselves, they're more than welcome to do that. They should already be unmuted, should be able to do that themselves. And if you're having any trouble, just chat to me and I can unmute for you.
Great. So I would love to hear how you think this might either be in partnership with the regular starter kit, totally different audiences. If you feel like, ooh, Mrs. Jones was never willing to talk about X, but she would be willing to do this. Lindsay suggesting planning to share with our caregiver support groups. I think that's a great idea. You know, there's so many different diagnosis-specific caregiver support groups. This feels like an important thing within facilities to figure out what are those patient and family advisory committees or breast cancer support group or whatever that might be, to try to get the word out. And a reminder that organizations can they can adapt it if they want to put their logo on it or something so that it's, you know, distributed by a particular facility.
I wanted to say something, Kate, about something I mentioned earlier, which was this theme of trying to get all of the different bits and pieces. I shouldn't say that. I mean, people have developed some really wonderful tools for advanced care planning. You know, we've all pretty much kind of done it, not completely in isolation, but we've kind of each developed our own thing. And I really think when I was, you know, working with my health system in Oregon, you know, I was sort of faced with, wow, do I do the conversation project or do I try to work with Prepare, which is a website? Do I try to train everybody in Vital Talk? Do I try to do the serious illness care program? Do I do Respecting Choices? You know, we have a robust program in Pulsed in Oregon. You know, how does that fit in? So I think increasingly with time, what I'm hoping is that all these wonderful assets will begin to weave together so that health systems, you know, can kind of go to one place and think, okay, I've got, you know, a pretty comprehensive solution here. And then it can be clear how each of the pieces, you know, if you don't get all the pieces, how they all fit together and what you accomplish by investing in each one.
So there's a comment from Amanda. Well, actually, can I just say to that, Eric, it's one reason I'm glad that TCP and Ariadne work together on this. You know, it's helpful to have blended some of the learnings we have from public engagement with what you guys have learned in this with the Serious Illness Conversation Guide and how to match it a little bit to what clinicians are likely to ask a patient about, especially any that are doing the serious illness program, so that people aren't coming in talking past each other about totally different questions. So I think that that's a real benefit. It's coming from Amanda that thinks this guy would be very useful at the skilled nursing facility level, both rehab and long-term care. Do you see practitioners like social workers or nurses using this with patients?
Absolutely, Amanda. I think, you know, that we tried to design it so that, you know, a patient or a family member could do it without the help of a professional. And you know, the questions are the questions, like they're valuable questions, and you know, I think for a clinician to go through the workbook with someone is really enlightening. I mean, it's a great way to have the conversation, actually. And if you do that, then it's done. You've done the conversation. So I do think, and what we found is that nurses, social workers, chaplains, really anybody can do our conversation guide. The only part where there's maybe some sort of scope of practice that is more towards nurse practitioners or PAs or physicians is in the questions about prognosis or what's likely to be ahead. That said, we have found that social workers and nurses often are comfortable once they sort of get over the hump of, oh, we're not, we're supposed to let the doctors talk about that. If they are empowered to talk about it, that they can talk about prognosis in terms of function or uncertainty in ways that actually feel very natural to their practice.
That's great.
It's a great question. And
I like it.
Anything to help long-term care. Boy.
Yeah. I was going to say, I remember there were different facilities, long-term care, where they would have patients do our conversation starter kit upon arrival, but I actually think this is the more appropriate document to do, or the more appropriate exercise, or even to have just distributed for those with the cognitive ability to sit and do something and then say, we're going to come and talk to you tomorrow about this. But to give, this isn't necessarily the conversation guide of how do you do the ice breaking, but it's to get somebody to be able to put their thoughts down, get them out of my head, have these prompts to help me remember, like, oh yeah, I have another thing that's important for you to know about me. So that's one of the goals. And Patty Moore is saying she thinks it's going to be particularly helpful for patients with dementia and their caregivers. So Patty, it's helpful to know that we do have an Alzheimer's version, Alzheimer's dementia version of our starter kit, but you're kind of getting to what I'm glad we're making changes about, where in the future that kit is going to be for the caregiver. But this tool, especially if it's early in a diagnosis, not just a diagnosis, but the progression of the illness, that somebody would be able to help fill this out. So yes, I think there's a lot of value for a lot of different conditions, if you will. See if there's any more questions or thoughts. I think we're looking for kind of dissemination. So this work was funded by the Cambia Health Foundation, and in the course we'll be focusing on the evaluation component as well as dissemination. So getting a Spanish language version of this, looking at, it's a little hard right now. We're not speaking at as many conferences or introducing this at as many events as we might have been otherwise. But if you have thoughts either on groups that you're a part of that you could help us disseminate, or here's the conference you should try to go to, or here's who you need to send it to, we would love your thoughts as it relates to dissemination, because that's part of what we'll be doing going forward. And so right now, I don't need to keep people if folks have said their piece. Looks like Patty's going to have to pop off in a few minutes. So just wanted to remind folks of way that they can engage with us. We'll be on social media. You can be looking. Another thing to keep an eye out for in the coming weeks and months is a new blog series that we'll be starting, where we have a lot of guest bloggers who are writing different pieces. So to be sure to follow us on social media, as well as our Facebook discussion group for community champions. We now have something like 220 people over there, and I'd love to see that get busier and busier. So if you haven't yet joined our Facebook group, please join us over there, and please answer the questions at the beginning. There's a couple questions to make sure you're not a bot, which you would be surprised the number of bots we get that try to join that Facebook group who don't answer anything, and they just joined Facebook 12 hours before. So please fill out the questions. And be sure to join our map. If you're not yet part of the map or have a pin on the map, it's been exciting to us to hear people who are connecting with each other through this, or taking a look at the map first, see who else is in Miami. You can identify yourself as a community organization, faith-based organization, or a healthcare organization on there, and find others who are doing like-minded work. And to sign up for our newsletters. So we have a general newsletter at the end of every month that might go more towards lay people, folks who are just interested in the ideas of the Conversation Project. Most of you are likely on our community engagement newsletter. But to sign up for that, that's where we'll also have National Healthcare Decisions Day updates and such, and where we'll be putting some of those blogs. So we'd love to have you join us there. Our October call, the date and time are yet to be set. I think it's going to be Wednesday, October 21st. Oh, Gina's asking for the Facebook group. Let me go back up. It is the Conversation Project, Community Champions. And maybe, Chrissy, if you can pop the URL in the chat, that would be great for people. Our community call hour might be changing to noon instead of 3 p.m. Eastern, especially because Patty's now 8 or 9 hours ahead of time, depending on daylight savings. So it's likely to be noon on Wednesday, October 21st, but we're going to be focusing on reaching and harnessing the power of students. We have some really cool experiences of research that students are doing in this area, professors who are engaging students, high school, college, grad school, health professions, and not. Many of you will remember Christopher Joshi, our beloved project coordinator, who is now off at med school, and he just did a great event yesterday with some of his peers, showing them the jazz singer video work that they're doing with older adults in the hospital to help find out what matters to people. And so he said that it was really powerful to see how much the students were excited about this work and feel like this is why they got into medicine. So really kind of capturing that energy early. That's what we'll be talking about in the October call. So want to give many thanks to our generous funders, the John A. Hartford Foundation and the Cambia Health Foundation, who make these calls and this work possible, and to ask you for additional feedback. So after this call, you'll be directed to a survey. It would be great if you can give us feedback on today's call, things that you'd like to see us cover in the future. And again, you can share your contact information if you're interested in participating in the evaluation here. So thank you so much, Eric. Yeah, Eric is begging and pleading and saying, yes, please help us. But we're so glad for those of you who joined us today, and hope that everybody is safe and well. And thanks so much. And thank you, Eric and Chrissy, for participating today.
Thanks, everybody.
Have a good one.